Hello, everyone. A very good afternoon, good evening, good morning. Myself, Dr. Mansi. I welcome you all to Homeopathy Musings. So today we have with us a very senior doctor, Dr. Rajiv Karya, sir. I welcome you, sir, on the behalf of our Homeopathy Musings team. Sir will be taking a session on the clinical understandings of the liver remedies. Before starting our today's session, I will just give a quick look at our ongoing and upcoming courses on the Homeopathy Musings. So we have an ongoing course that is Basics of Contemporary Homeopathy, a 16-day practical course that demonstrates integration of classical and contemporary concepts of homeopathy. We have completed 14 sessions, but if any one of you or any one of us uh, who can benefit of this course, they can enroll still and they can get the recording sessions and they can attend the live 2 sessions pending.
अच्छा
Then after our two incredible journeys, that is with plant journey and animal journey, now we are starting in January 2026, Musings Minerals, a mineral journey with homeopathic musings. That is on decoding periodic table using integrative approach with classical and different contemporary concepts of homeopathy. The it basically strengthening the fundamentals laid by Sholton and Sankaran. So there will be 40 plus sessions. There will be 3 Q&A session with our chief mentor, Dr. Mahesh Gandhi, sir. Recordings will be available for one whole year. So if you want to register, you can register still, and you can. The course is starting in the January first week. Then we are starting our another clinical course that is female reproductive system and the therapeutics and illustrative cases and disorders, that is gynecological disorders, pregnancy related disorders, and the lactation disorders by Dr. Ajit Kulkarni, sir. There will be case taking approach, there will be clinical cases, pathophysiology of the diseases, and corresponding homeopathic remedies. There will be total 8 sessions in the month of January, that is on the Fridays and Saturdays. Early bird is still going on. So if you want to register, please register soon. It will be a great clinical experience and approach to learn how to treat the gynecological cases. Then we are starting, that is with Dr. Dinesh Chauhan sir, another course that is Learn Centennials. Integrative holistic approach in plant with higher order centennials with APG classification. There will be 2 sessions, that is on the 6th and 7th of March 2026. Sir is very known faculty in our homeopathic community. He needs no introduction, but still I would like to give a basic thing. That is, Sir has done the HMS PG Homeopathy from London Homeopathic College. That is, Sir has done diploma from International Academy of Classical Homeopathy, Greece, under guidance of George Vithalkar, sir. Sir is a renowned homeopath practicing in Vadodara, Gujarat, with a clinical experience of over 25 years. Sir is graduated from Gujarat Homeopathic Medical College, Savli in 1998, and he has done orientation teaching training from NIH Kolkata. Sir has treated more than thousands of cases with a very simple approach in homeopathy. I welcome you again, sir. Thank you for accepting our invitation and being on the part of our platform. Some basic hygiene factors. Please mute your lines all the while the speaker is speaking. Keep your videos on, which helps in the interaction and avoids temptation to multitask. Raise hand while the speaker is explaining. If you have any questions or comments, you can put it in the chat box and it will be addressed at the end of the session. Please do not scribble on the screen as it is very disturbing. Make notes, share your experiences, and most importantly, enjoy the session. For any difficulties or questions, you can always contact on our given contact details. I'll quickly stop sharing and hand over to sir. Hello, sir.
Hello.
Yeah,
So good afternoon to all.
good afternoon.
Hope I am audible to all.
Yes, sir.
Okay. So first of all, thank you so much for inviting me on this wonderful platform, Homeopathic Musing. Today I'll be talking about clinical understanding of liver remedies, and it is the demand of nowadays. When you see each and every sonography will give you fatty degeneration grade 1 liver. So when you go for a sonography, in Baroda especially, I have seen patients coming with grade 1 fatty liver changes. So nowadays, this fatty changes have been a grave thing that we should address at first. So I'll start with aim and objective. So what would be the aim and objective of today's session? To establish so-called smaller remedies in the treatment of great disease of liver through small cases. They have been turned smaller for the session where we have to showcase in a short time. Today we have 5 cases, rather 6 cases, and we'll understand this remedy to different repertories also, and we'll establish the indications of the remedies from Phatak repertory and complete repertory. And we need to understand the shortcomings of these remedies as they are presented well in our old books. Now, problem lies that we don't look for the old books, and some BGN have stopped printing old books like Blackwood and Boger, and old books have been stopped printing. So it is a clarion call that one should tell them to publish once again the older books, which we used to read in our time. Now the epidemiology of liver disease.
Hello, sir.
Liver, yes.
Very sorry to interrupt.
Yeah,
So
yeah.
if you can make it little full screen, we will be able to see the
Okay.
writings. Yeah.
Let's see.
So you can just start the slideshow from the below.
Dear slideshow.
So the lower symbols, the first from the left, right hand side.
Fine.
Yes, sir. Thank you. Thank you so much.
So liver disease are fast being recognized as a public health priority in India. Dear all, this is very important for our understanding about the health priorities in India. The burden of liver disease in India is significantly high because of contribution to 18.3 of the 2 million global liver disease related death in 2015. Recent epidemiologic study data says 10 to 20% of Indian population suffers from various liver ailments, including viral hepatitis, alcohol liver disease, and non-alcoholic fatty liver disease. This rising prevalence is attributed to the combination of genetic susceptibility, lifestyle habits, and environment influence. The increasing rate of obesity, diabetes, metabolic syndrome, particularly in urban population, have intensified the risk of developing liver condition. Cultural attitude toward the alcoholic consumption and dietary practice also contributes to the rising incidence of liver disease. Now we should go for this trilogy. We will study the case from material point of view, organon point of view, and repertory. It is my habit when I start any webinar, I always go for this lecture on Kant's philosophy and their chapters. So these are the chapters that one should go through. First is the sick, the highest ideal of cure, what is the physician must perceive. If you want, you can take a screenshot because these are the most important for our understanding of our philosophy, where Dr. Kant has given very, very important chapters. Unprejudiced observer, which is aphorism 6, indisposition on simple substance, disorder first in vital force, materialism, law of similar, and 14th is the susceptibility. Now, this next book is very good and very knowledgeable book. One should read daily the book by Dr. Stuart Close. These are the chapters: the psychological point of view, general interpretation, school of philosophy, the scope of homeopathy, utility of medicine, life and health and disease, susceptibility, reaction and immunity, general pathology and homeopathy, cure and recovery, indisposition, second best remedy. Very nice and very important chapter. Chapter 12, examination of patient, homeopathic philosophy, potentization and infinital dose, drug potential, logic of homeopathy, the development of Hahnemannian philosophy in the sixth edition of Organon. This is also a very good chapter by Dr. Stuart Close. The Stuart Close, I have taken one paragraph from this chapter 13. The three essential systems are the principle, the remedy, and dose. These three are equal important: posology, potentization, and this subject is misunderstood and needs lot of discussion. In the earlier days of homeopathy, after two opposing camps grew tired of the subject, and this it came to be regarded as Gordian knot. Gordian knot, which was told by Alexander, where he cut the Gordian knot. Hahnemann himself, at one time, almost in despair of every being able to bring his follower to an agreement on subject, cut the known by proposing all cases with 30 potency. This is very important paragraph from Stuart Close, dear student. The state of affair is unfortunate, assuming that there is a difference in action of various doses of medicine and series of potency and preparation of the different medicine has been available for us. It follows the entire series should be open to every practitioner, that each man should be competent, willing, and ready to use any potency or preparation of the remedy indicated in the given case without prejudice. This is the paragraph from Stuart Close, page 184, which means a lot for me. Again, I like to read: is state of affair is unfortunate, assuming that there are different action of various doses of the medicine, series of potency or preparation of different medicine has been available for us. It follows the entire series should be open to every practitioner, and each man should be competent, willing, ready to use any potency or preparation of the remedy indicated in given case without prejudice. If he confines himself to one or two potency, be that low, medium, or high, he will be limiting his own usefulness, depriving his patient of valuable means of relief and cure. This is very, very important. So under homeopathic philosophy, any potency should be required in any case. The expert will have the discrepancy of using any potency which is required for the case. In either case, those who follow the course governed by love of ease and prejudice, that they are by desire of efficacy. The selection of dose is as much integral part of the process of making homeopathic prescription as selection of the remedy, and often quite important. A well-selected remedy may fail utterly or even do injury because of wrong doses. This is very important. Dose as well as remedy must be adjusted to the patient need. Dear colleagues, this is the very hard statement given by Stuart Close, page 184, chapter 30. So, liver remedies. First, starting with liver remedies, liver structure. Liver is the largest gland in human body, which weighs 1500 grams. The color is reddish brown and shape is wedge. This is clinical examination that we do on the right side, and the lower liver edge is felt with the surface structure, which shows the consistency and the size of the liver. Clinical examination of liver involves inspection, palpation, percussion, and auscultation. In inspection, we tell the patient to lie and supine, ensure that warm and comfortable, maintain their privacy and appropriate draping. Visual assessment. Look at the gross asymmetry in the abdomen and inspect the skin for signs of liver disease such as jaundice, caput medusa, and spider angiomata. Palpation techniques. With the supine, place your right hand on the abdomen just lateral to the rectus abdominis below the lower border of liver dullness. Ask the patient to take a deep breath to help palpate the liver edge as it descends. Very important. Finding. Note the texture and tenderness of the liver. A normal liver may be slightly tender, while greater tenderness may include inflammation or congestion. An irregular firm liver suggests some abnormality. Technique, percussion. Start percussion mid-clavicular line at the third intercostal space. Move downwards, identify the upper border of liver dullness, then percuss from above below and to find the lower margin. Measurement, the vertical distance between the lower and upper and lower margin assess the liver size. A normal liver span typically around 6 to 12 centimeters. Auscultation. Listen the liver area for abnormal sounds such as bruise or venous hum, which may indicate vascular abnormalities. Addition signs. These are the addition signs that we have to see. It can be some jaundice, gynecomastia, testicular atrophy, spider nevi indicates chronic liver disease or cirrhosis. Techniques for detecting ascites is shifting dullness and fluid weight test. These are the most important thing for ascites assessment. Proper examination is crucial for diagnosis, condition, and determining appropriate management studies. The anatomy of the liver. You know, as a doctor, you know all this anatomy of the liver. This is the physiology that we are shown in this PPT. Then what are the essential liver functions? These are all the essential liver function: detox, breakdown alcohol, medication control, 500 metabolic process. This is very important. Regulates blood composition, produce bile, produce protein and cholesterol. Damaging liver. Liver over 500 functions. Why do we need liver protection? It is very essential to protect our liver. When we overload with lot of prescription, OTC prescription, nowadays people buy a lot of drugs without prescription of the doctors. This is very dangerous for liver changes. So signs of liver disease. Early cirrhotic changes can similar to signs of hepatitis. General tiredness and fatigue, muscle and joint pain, itchy skin, jaundice and dark urine, loss of appetite, dull pain in upper part of the abdomen. These are the signs that every doctor should know for treating liver disease. So disease of liver, jaundice, cholestatic, liver, cirrhosis, hepatic failure, vascular liver disease, and so on. This is the healthy liver, fatty liver, fibrotic liver, and cirrhotic liver. This is how our liver has these changes. Excess of fat builds in the liver is the fatty liver. Connective tissue replaces by normal tissue. Formation of nodular structure surrounded by fibrostic. This book you should refer daily. This is there in my cabin and my desktop. Daily I read. There are many other books, but it is very friendly for our understanding. Now this is the excellent book for liver and pancreas and ductless gland. If you want, you can take a screenshot. This is a very nice book by A.L. Blackwood. I read almost daily on my practice level. And this is the marvelous and wonderful book, A Synoptic Key of Mater Medica by C.M. Boger. Now what I have done, I have taken 39 remedies from Boger Synoptic Key to understand the sphere of action. When we open Boger's Synoptic Key, there is a sphere of action chapter, one side on the left side, and the right side there are modalities. So this slide is very, very important because this has been made by me with lot of pains because we have to find all 39 remedies affecting the liver. The first remedy is Aesculus, where the veins are involved and then the liver is involved. Second is Ethusa. Third is Aurum Met. Fourth is Astaclus fluitis. Berberis, very important in Berberis. First, the digestive tract is involved and then the liver. Dear colleague, this thing has to be known in the journey of the disease if you want to know the liver affection. Liver affection, in the course of liver affection, we should know which path is involved first. The digestive tract is involved and then the liver pathology. In Aesculus, the vein is involved and then the liver. This is very important. Pathophysiology or physiopathological changes. Then comes Bryonia. Then comes Calendula. Be very surprised. But Calendula has some symptoms of liver pathology. Then comes Cardas marianus, which is important clinical observation in cases where weak upper lip. This is very important. Weak upper lip. And right tongue in Cardas marianus case. Dear student and colleague, this weak upper lip is important clinical understanding for Cardas marianus cases. I usually see this symptom for many Cardas patients. Then comes Chamomilla, then Chimaphila umbellata, which this drug is used for prostatic complaint, but this has all the affinities for liver also. Then comes the secretion. The China cinchona affects the secretion of the body and then the liver. This is how the Boger has stated. Then Chionanthus in the bold letter, gallbladder stone with constipation is very important indication of Chionanthus. Dear student, this is very, very important indication of Chionanthus when we see gallbladder stone with constipation. Then comes chloral hydrate, then comes collinsonia, then comes Cornus succinatus, excellent drug for liver and also for ADHD given by TFLA. Then comes Cortellus horridus, the snake. Then comes the digitalis, which affect the circulation first and then the liver. Then comes Epiphagus. And this Epiphagus has this sopping mania. Nowadays, marriage season is going on. The ladies who have the problem with lower limb. So Epiphagus is one of drug. And in Epiphagus, there is spitting tendency is there. And it is good for tartar of the disease. Another drug is Phageria. Unanimous is excellent remedy for liver condition, enlarged liver, gallbladder, albuminuria, profuse stool of various color like podophyllum, vertigo in forehead, and aggravated worse eating. And many CKD you can solve with Unanimous. Unanimous is a very good drug in treatment of liver and kidney disease. Eupatorium per has the affinity or sphere of action on liver, and the modality is vomiting of bile is very important modality for Eupatorium per cases. You have to confirm, or you can ask vomiting of bile, or you can ask burning of eyes for confirmation of Eupatorium cases. Formica rufa, there is a affinity for sphere of action of liver. Suddenness is very important in Formica cases. Gambogia has burning pain, essential. Worse after stool. This is also important for Gambogia cases. And in Hemamelis, essence of Hemamelis is varicosity and they are very censorious. Other censorious drug, you know, carcinosin, arsenic and many others. Iris affects the gland and then it affects the liver. Other drugs is Chionanthus, iris, natrum salt, natrum mure and nitric acid. Lapa I use for acne cases and also associated with liver complaints. So skin, liver, joint, and secretion. This is how we should use Lapa. Lapa is from Asteraceae family, composite family. Meccar, digestive system, and then the liver. Very important. Megmure, liver, mercury gland, very important. Myrica, Myrica has very important liver with heart condition, better by open air, discourage, slow pulse, jaundice in inflamed, urticaria with liver condition is also very good drug for urticaria with liver condition. Then comes Natramur, which affects the gland, Natramur, Natrum sulf affect the gland, acid nitric which affect the gland. So any glandular pathology leading to liver changes. Then phosphorus, podophyllum, excellent case. I will show you one of the case of podophyllum. Podophyllum has affinity for duodenum, intestine, and the mind symptom is truthfulness that we have to see in podophyllum cases. Rheum. Now, dear student, rheum has the affinity to attack muscle of bile duct and duodenum and intestine. Please use this rheum as a remedy for bile duct problems. This I have learned from Boger Synaptic. Sanguinaria +3 liver remedy. Other liver remedy are Chionantha, Iris, Magnure, and Sanguinaria. Selenium, selenium is famous for loquacity, crave stimulant, and stains leaning yellow. This is very important of selenium cases. Mercury and Thuja. I have cases where the patient showed that whole banyan is covered with yellow stain. This selenium cases. Taraxacum, one of the best remedies for liver with bilious sick feeling, night sweat, like Sambucus, aggravation less, better by walking. The last drug is Attica urens, which has affinity for mammary, liver, genitourinary, and spleen. This is very good remedy where you see liver and spleen enlargement. Now slot clinical indication for liver remedies. These are the clinical indications, short indications for liver disease, liver remedies. Cough with salivation, Ammon Muir. Cough associated with catarrh and affection of liver, boric. This remedy should be remembered in fat, sluggish subject who suffer from liver complaints and gallstone. There are extreme obstinate constipation. So Ammon Muir cases will have obstinate constipation, cough with salivation. The stools are hard and very compelling, requires great strain in expulsion. Blackwood. So this is the source taken from Blackwood and the boric. This is the old book which help us to understand this remedy Ammon Muir. So Ammon Muir is a good liver remedy when it has coughing with salivation. Then second remedy is Aurum Met. So in Aurum Met, you will have symptoms of soreness over liver, hepatitis, ascites, and jaundice of pregnancy. This is important in Aurum Metallicum cases. And liver with heart complaints that you have seen in Myrica. So you can write down Myrica and Aurum Met. And then comes Bryonia. Liver, in Bryonia cases, liver region will be swollen, sore, tensive, heavy, ambulation lying on it. This is important modality of Bryonia. Then comes Chelidonium. This liver pain, you know, Chelidonium is very famous, right shoulder and occiput. This is a prominent liver remedy covering direct reflex symptom of the disease organ of that organ. My God, this line is very important line given in Bore. The first line in generalities. Do remember this. I will like to read it again. A prominent liver remedy covering many of the direct reflex symptom of the disease organ of that organ. Disease condition of that organ. Then neuralgia of the right eyes, right. So right-sided affinity of Chelidonium. Then comes Chionanthus, enlarged liver, jaundice occurring every summer. Now in Chionanthus, the patient will tell you that I have every summer jaundice. This is very, very, very important symptoms that you will see in Chionanthus given by Dr. Clark. So jaundice with arrest of symptom given in Boric. This symptom you used to remember to treat your patient. A prominent rival remedies like gallbladder stone As the gallbladder stone are difficult to cure, but this is one of the remedies that will help you to solve many gallstone cases. Berberis, cholestyramine 3x you can use, and calciricum. And this chionanthus has affinity for diabetes also. Paroxysmal abdominal pain is important in chionanthus cases. Next is Cornus, which I told you it is a drug for attention deficit. Liver symptom with aching eyeball. This is very important. This symptom. Liver symptom with aching eyeball. Vesicular reaction associated with chronic liver disease or aphthous stomatitis. Boldo. Boldo I have used in many of biliary calculus and it never fails in my case when the symptom agree. Boldo one should use in mother tincture or six potency. It is painful hepatic disease, disturbed liver and history of malaria. Then comes China, periodical liver symptom, gallbladder, swelled liver and spleen. And this sentence, I removed the dropsy and review all the symptoms of case of cirrhosis of liver in hard drinker given by Clark. These are the clinical indication of China. Then comes chamomilla, a great drug. The remedy in the attacks brought by fit of anger. Without anger, chamomilla should not be prescribed. So what he writes, there is sensation of distress in hepatic region, which is aggravated by motion. There may be colic pain with vomiting of bilious material and anxiety and jaundice. This is being given by Blackwood liver for catarrhal or obstructive jaundice. Chamomilla is an excellent remedy. Then comes digitalis, the hypertrophy of the liver. With induration and jaundice,
Hello, participants. Sorry for the disturbance. There might be some technical issue. Please wait for 5 minutes. I'll just convey what's the issues. Sir, you're on mute.
I'm sorry for the inconvenience. There was some network problem on my side. The last clinical indication we saw hydrostasis, and I have a case of hydrostasis in my practice. I'll show you if time permits. Let's go forward. Now, for hydrostasis, this important sensation is goneness sensation. One has to see this goneness sensation in many hydrostasis cases. And tongue coated yellow and bitter taste in the mouth. Unanimous, what I told you, it is a good drug for liver as well as kidney. There is intense occipital pain that we see in unanimous cases, atropurpurea. I'll show you the plant kingdom classification of unanimous. And it is a good drug for obstructive jaundice. Now, this is a unanimous plant. There you see it is from Celestraceae family, and this is the photo of unanimous where the heart bursting with love. Just see uh, the fruit of the unanimous. They are red in color and it is from the rosette family. So this is the classification of unanimous Heteropurpurea. It is from the family Celestraceae and rosette. Rosette is subclass classification 5, subclass 5. The mind symptom of unanimous. Because why I have put this unanimous? Because it is seem to be a rare drug, but there are few mind symptoms which are very, very important for our clinical understanding. There is confusion of mind, delusion floating in air, delusion drawn floor, keyword drawn from irritability, loss of memory, cursing, swearing desire, forgetfulness, word spoken to, injuries excellent, ailment from, quiet wants to be rested, tranquility desire like nux vomica, walking emulation. Now this symptom of 11 now, part, work, routine, perfunctory manner, perform in. Now dear student and colleague, this this is very important mind symptom of unanimous and tilia trifoliata, because those patients who are very routinist but they don't perform their work in perfunctory manner. Perfunctory means not in a seriously they do their work. The other symptom of unanimous is mind mental exertion aggravation, yellow sclera, and congestion of liver and spleen. Rectum diarrhea with constipation, urine albuminous, menses too early, pain joint, gouty, chronic, complexion brown. These are the other symptoms of unanimous. Now the cases of liver remedies. The first case, a man aged 55 years came for the complaint of skin itching with hyperbilirubin level, having long history of alcoholism. He was having lots of anxiety about health, and also he said, I am responsible for my deeds. Recently diagnosed with pneumonia also. Further story. He said that I drink a lot. I used to beat my children. My God will punish me for that. I have spoiled my life by drinking. Quarrelsome by nature. Dear student and colleagues, these are the short cases which are been put as a short way. There are long cases being taken. So this is the repertorization. Mind alcoholism, dipsomania. Mind anger throws things. Mind health about choleric bilious. This this remedy has very important mind symptom, anxiety, health about ruin ones that he has. Chest inflammation, lung pneumonia, liver complaints, and quarrelsome. The first remedy for the first case is chelidonium. So pointers to chelidonium from NERS repertory. So NERS repertory, I'm giving those these symptoms. These are very important symptoms. Anxiety conscious of, delusion health he has ruined, which is very important. Delusion insane, he will become. Mencina cases has this. Doubtful of soul's welfare, very important. Dullness, could not think about oneself. That is the single remedy. Indolence. Conan children also has this capsicum. Religious affection, silent and taciturn. Chelidonium 200 2 dose followed by 1 m and LM5. Learning from the case 1, Chelidonium subclass 1 liver remedy. Chelidonium patients are sensitive by nature, simple, naive, sometimes as they belongs to subclass 1 Magnolidae. They blame themselves for ruining their own health also. So the first case which we have given is Chelidonium. Now this is Chelidonium papaversi subclass 1. This is the plant and this is plant classification from papaversi, basically ranunculus. Chelidonium has this Chelidonium majus, alkalized papaversi, papaverin, And this part is very important. In the Roman period, the root extract was to treat minor cuts and infection. Chelidonium was used in this. This is Chelidonium, chronic jaundice with lung symptom, rubbing sore. This is very important. Rubbing sore you will see in many Chelidonium cases, good for liver cancer, desire to beat children, knee burning. You will see knee burning or rheumatism of knee, you will see in Kent's repertory. You can open your Kent and see that Chelidonium is in 3 marks for rheumatism. Then ankle stiffness and eruption ankle. And another drug is argentum mat with swelling. Fat around abdomen. Fat around abdomen, we have ammonium, calcarea carb, nux moschata, and chelidonium. Appetite lost and wanting. If stool, I get mentally relaxed. This is important. And chelidonium may have oscillating fever like China horse and pyrogen. Nausea better by milk. Palm and yellow with ascites. Paralysis and rigidity of muscle. King of rheumatism. See, king of rheumatism is chelidonium with stiffness and rigidity. Sweat aggravates sweat in pain is important entry point. Ulcer rapid and malignant. Yawning frequently. Case 2. So now we'll be starting case 2. A case of a girl aged 8 years came for consulting recently with cholelithiasis, having symptom of recurrent vomiting, lot of retching and gagging, had history of taken oily food outside. This is important in this remedy. Oily and outside food. In India, it is very common. She wanted to cling to the attendants and she was better rubbing at the abdomen. This is the entry point of this remedy. That was overstating. This patient, 8-year-old girl, had overstrained herself during Navratri season. This Navratri season is where we pray to goddess and we do Garba. Gujarat is famous for Garba playing. So this girl had come for this, had history of long straining doing Garba. Offensive stool. What were the other symptoms? Offensive stool, teeth grinding, tongue flabby coated, vomiting exhausting, and abdomen pain better by rubbing. Podophyllum 30 and then 6 was repeated. Giving 30 chills started. The remedy was reduced to 6 in repeated doses. Hepatomegaly, cholelithiasis, hepatic renal cortical cyst. This is the report. Doctor's advice for surgery. Liver function test. This from Fatak. This repertory, Fatak was consulted. Liver enlarged, rubbing, shaking, ambulation, retching, gagging constant. This is important. Rubbing, teeth grinding, teeth flabby, rough, rubbing ambulation. Podophyllum barbarity, typhoid myxome according to Dr. Shankar. Learning from case 2. Being unprejudice observer in your clinic setup with that is aphorism 6. Observation or case is important tool for entry point. This remedy podophyllum has good affinity for liver and gallbladder stone. If it is taken in olive oil, refer herring guiding symptom boiling weight. So this herring guiding symptom give podophyllum for the use of gallbladder stone. When it is used in olive oil, it's give a good result in gallbladder stone. This is Podophyllum flower, subclass 1. This is Barbadeaceae. A genus flowering plant of Barbadeaceae from Afghanistan to China. Genus differ Carl Linnaeus. Podophyllotoxin is genital warts. This is important. And Molluscus contagiosum. Molluscus contagiosum, silica is the drug. Variolinum is the drug. HPV infections. Podophyllum alkaloid and podophyllum. Podophyllum liver. Jaundice with gallstone. Very important. Whining in sleep is very important in podophyllum cases. Taste, bitter, loss. Rubbing, stroking liver is important. This symptom is very important entry point in the liver case. Loquacity during fever, chill, this is important. Liver enlargement, itching, eating emulation. Only drug is podophyllum. Guilt sense of fruit canned aggravation, craving for sour things, very important again. Business worry, appetite loss, chill with desire to talk is very important. This is given in Boric also. Appetite loss and wanting. Bite impulse too. Calculate. Now, dear student, hearing guidance symptom gives you prostate problem with rectal troubles. Recently, I had case of prostate problem. He improved with this podophyllum. Stretching impulse to do with drowsiness. Amyl nitrosum, hormone mute, TMV, and Crocus satis. All problem worse in summer season. Everything tastes sour. Teeth binding and clenching. Tongue flabby and rough. Points to chelidonium case. Prolapse of all kind, vagina, uterus, and rectum. This prolapse is the essence of podophyllum. Very important common entry points of chelidonium and podophyllum. Right pain in the right scapula, sleepiness, stools are yellow and bright. This slide is very important. You can take a screen slide where the chelidonium and podophyllum has a common entry point. This is very, very important for clinical understanding. Taste bitter in both the remedies, tongue and diarrhea, constipation and diarrhea, both the remedies, tongue in indented both. You can take a screenshot of this slide, very important slide it is. Now case 3. A case of 20-year-old boy vomiting with hip joint pain, yellow face with fever, causation after history visit to a Goa. So he had drank too much amount, good amount of beer with college friend with frequent urination detected with diabetes. Sonography shows early changes of liver cirrhotic. Other symptoms, stool hard, hip joint pain, worse lying on left side. Worse lying on left side, very important. Sleeplessness lying on left side. 2 remedies in Fatak. Sepia is a dream lying on left side. Tuberculosis of bone detected hip joint disease. This is important past history in this case which led me to prescribe this drug. So Cardas Marianos in Q and then raised to 6. This is the repertorization. Beer aggravation, liver cirrhosis, stool hard, tuberculosis, sleeplessness lying on left side. Very important for Cardas Marianos case. Sleeplessness lying on left side, Cardas and Puja. Fata.
Please the repertory again.
क्या हुआ?
Please the repertory. Can you show this again? The repertory for this
Repertory is
case?
Fatak. Fatak repertory.
No, the repertory you use. Yes,
Repertory.
this slide, please. Yes,
Yes.
thank you.
So this repertorization of Cardas Marianos case. Then sleeplessness lying on the left side, Cardas and Tuja. This is very, very important entry point of Cardas and Tuja cases. Dream if lies on left side. Refer Boger, Sepia is one of the drug. Beer and sugar metabolism. Borix remedy. Abuse of the alcoholic beverage, especially beer, varicose vein, ulcer, disease of minors, associated with asthma, dropsical condition depend on liver disease, when due to pelvic congestion and hepatic disease. Disturb sugar metabolism, influence when liver is affected. Debility, hemorrhage, especially connected with hepatic disease, very, very important. Very, very important for Cardas cases. Cardas has silymarin or Silibin marianus. First of all, beer aggravation, important entry point, diagnosis of liver cirrhosis, past history of tuberculosis, sleeplessness lying on the left side. This is Cardas marianus, subclass 6, Asteriaceae family. This is kingdom classification. Aster is Silybum, or it is called Silymarin. Silybum mariana is a species of thistle. Common name is milk thesis or blessed milk thesis. It is from family Asteraceae, subclass 6. Silymarin is the alkaloid used for the treatment of chronic liver disease and adjuvant for chronic hepatitis and cirrhosis. It is immunomodulator in many cancerous cases. Silymarin. Please understand the role of silymarin in the treatment of many cancer. It is used as iron chelating and antioxidant properties, hence used in the treatment of beta thalassemia. Very, very important. Many cases of beta thalassemia, you should give Cardas. This because thalassemia cases have lot of iron load. So when you give Silymarin or Cardas marianus, this will improve. This is most important slide for the treatment of cancer and this anti-iron chelating and antioxidant. Boric, cirrhosis with dropsy. So Cardas marianus, liver disease, jaundice with fever, stools are hard, all kind of splenic troubles. Damp, wet weather working aggravation, dropsy with liver. This is important. Urine yellow, veins are hard and thrombose, vomiting, bilious ambulation, hookworm, chalisma, cadmium, aversion to salted meat, bleeding, ambulation in many cases of Cardas cases, epistaxis in young people. Beer is important. Weakness of upper lip, you will see in Boger. Hypochondriacal cases. So Cardas marianus has hypochondriacal cases. Tongue is red, center indented edges. Hepatohemorrhagic diathesis, word used by Boger. All gallbladder stone with burning. These 3 remedies. Chelidonium, Podophyllum and Cardas. CPC. Jaundice with lung symptom. Cardas and Chelidonium. This is Chionanthus virginicus. This is Chionanthus from Oleaceae. This Chionanthus virginicus, it correctly treated as masculine giving species ending with virginicus. The name was given on this basis. Native Americans used to treat with skin inflammation. This Chionanthus I am talking about. These are the rubrics of Chionanthus. Abdomen bend about, bilious, diabetes, diarrhea, jaundice with eye sore, forehead sweat, gallbladder burning stone, hand sweat, cold stool, hand sweat on cold vomiting, hand sweat, jaundice from cider, jaundice menses arrested, important. Jaundice every summer, lying of abdomen ambulation, stool black, urine specific gravity increased, lying on abdomen. This is 3 remedies common rubric. Which are the remedies? Chelidonium, Chionanthus and Podophyllum. CCP. Case 4. A recent case of 60-year-old patient came with a complaint of CA liver having symptom of anorexia and chronic constipation, also poor memory, tendency to abuse as a part of mental nature, use foul language and hatred for other communities or people and took revenge. Profanity. This is a word given in Bonningerson. Hatred and revengeful. Stool hard, knotty with mucus and coated. Tongue coated yellow. Hydrastis. This is the remedy. Depending on susceptibility and posology is being suggested. These are the reports. So adenoma likely. Mild hepatomegaly with large, well-defined enhancement pattern described at segment 6 and 12, right lobe, intramural. These are the reports of this patient. See, this is the repetition. Memory poor, liver cancer, profanity. Profanity matlab those patients who speak foul language. This is profanity. Mouth coated, tongue yellow. 3 repertoires were consulted: FATAK, BBCR, and reliable repertoire. Very important emphasis was considered on BBCR. FATAK did not have profanity. So profanity rubric was taken from BBCR. See the repetition. Liver cancer, profanity covered, and delusion ruined. It is from the chelidonium hydrosis. See, chelidonium and hydrosis comes together. But how the chelidonium differs? Chelidonium has delusion of ruin, which hydrosis doesn't have. And this profanity hydrosis has. Can you see the difference? Very, very, very important slide. This differentiates the mind symptom of both two common liver remedies. Again, I'll like to stress upon the fact that chelidonium has this mind symptom, delusion, ruined he has life, and hydrosis is this profanity. So malarial myism, according to Dr. Sankaran, this is hydrosis, the golden seal, subclass 1. Hydrosis, ranunculus, nitric acid induced hydrolysis of hydrostine, which is patented by Bayer as a hemostatic drug in early 1900. This hydrostine muriaticum is drug used for menorrhagia. It is given in Borix Matermedica. Berberine. Many people use this berberine. Yellow pigmentation and raw berberis material. Ultraviolet ray berberine show yellow fluorescence. Berberine have traditional use, extra sold dietary. It is a dietary supplement, berberine. Now, berberine in 8x it is available. 8x in Weasel Pharmacy. Profanity. See profanity, you will see hydrosis. No chelidonium here. This is profanity. Tongue of hydrosis and chelidonium. Confirmatory symptom of hydrosis. Face oily, jaundice, lung symptom, liver atrophy, liver cancer, liver cirrhosis. Usually liver cirrhosis and liver cancer, uterine cancer, stomach cancer, lip cancer, psoriasis, and lupus. Abdomen diarrhea, sense of abdomen retracted, abdomen stone as if accumulate conical growth eruption, air inspiring cold aggravation, ankle ulcer from FATAK. Appetite increase about 11 a.m. Bronchitis, dislike writing. Aversion, dislike writing. The only remedy. Bronchitis, burning raw, smarting, calculi, cancer, constipation, obstinate, drug abuse of duodenal infection, podophyllum. Chamomile is acute, chronic is calibacronica. Eczema, hairs, margin. These are all symptoms. Muscle twitching, magnesium deficiency is there. Nose oily, very important remedy for nose oily. Pellet heart cancer, FATAK, repertory, only drug. Now, from Dr. Buck's Matermedica hydrosis. This remedy was first introduced as specific for cancer, but unfortunately does not maintain its early reputation. All new remedies are apt to be over. Estimate like hydrosis, however, appears to possess a virtues that proved valuable in the treatment of memory tumors such as irritable and then ulcerative. But true cancer does not yet take rank over a snake. So Dr. Buck said this hydrus is a little lower than arsenic. It possesses considerable power to allow external application and can remove the glandular swelling. External application of Q can be used for reduction of glandular swelling. Burnet fistula and hydrustis. By reading this, Burnet, I had solved a case with hydrustis mother tincture. And this is the case given by Dr. Burnet. A gentleman of 46 years of age, LNRT to all my appearance, consulted me for fistula in ano. He plagued me with number of months. An operation had been decided upon. The foul discharge was the only thing that really inconvenienced him, with a certain amount of local irritation and little blood once in a way, but did not heal. One day he met with a gentleman, an old friend of his, and whom I cured severe fistula several years previously. The result was that he came to me. Under hydrustis Q, he got quite well in less than 2 months. See, less than 2 months. Dr. Burnett. No local application of any kind was used. He was more pleased in his rapid cure as he was about to marry at that time, and fistula is not desirable under such circumstances. N.M. Chaudhary. Tincture is prepared from the root of hydrustis. Color of tincture is highly yellow, intense yellow color. And hydrustis has special affinity for mucous membrane of the body. A second characteristic of hydrustis is gone feeling felt after meals. This is important. After meal. Symptoms renders important in dyspepsia. Large flabby coated tongue. Sluggishness of liver. Stool are lump and covered with tough yellow mucus. What can said about hydrustis? Obstinate piles. Ulceration and fissure of inner, cured constipation. Old case of anyone no longer. Now this is very important slide. Liver remedies and therapeutics. Liver problem with bleeding piles, leptendra. Liver problem with splenic disease, China, manganum carb and manganum sulfate. Liver fatigue detention, vanadium. Short result in many cases. Liver enlarged, Magmure, Nux vomica and Vipera barus. Liver enlarged, chronic, colestrinum, especially in 1M potency. Liver cholelithiasis, biliary coli, Berberis, Cardasma, Chelidonium, Diascoria and Mangrovora. Liver cirrhosis, alcoholic, Calcareous, Cardasma, lauric acid, muriatic acid, Nux vomica. Liver affection with heart, digitalis. Liver alcoholic, calcareous, cardasmar, fluoric acid, muriatic acid, Nux vomica. Liver Indian childhood cirrhosis, Chionanthus, millefolium and phosphorus. Now case 5. A case of a school girl came for a complaint of migraine, headache and bilious vomiting. Every time she had an headache. She had difficulty in concentrating subject because of that, also weak memory, and she has a stress as she had to give 10th board exam. Very important, she said. I have wandering thoughts. Farta vichar. That is in Gujarati, she said. When I am writing my homework notes, and she really worried about it. Blood exam shows high SGPT level. Very important. Was headache better by drinking cold water? And was eating sweet? Now, dear student and colleague, this is important entry point of this remedy. Headache better by drinking cold water and worse eating sweet. So Iris repeated wandering thought while writing. Headache after sweet. Not covering so far, but referred Blackwood material. See, knowledge of Blackwood material could reach this Iris remedy. This is the book. Excellent book for understanding therapeutic and pharmacology. A.L. Blackwood. Headache are frequently produced by eating sweet. See, the child had this problem of headache after eating sweets. There is great burning referred to epigastric pain. Reason. The sensation of burning is but temporarily relieved by drinking cold water. This information was given in Blackwood Mathematical. It is therapeutic influence on the skin, especially eczema pustulum, and interval itching worse at night, croton tig-like. All psoriasis when constitution symptoms are present. In the case of eczema, it is found usually in mother tincture or lower potency every 3 hours. This is also important slide for this remedy, iris. Blackwood says it is a vegetable mercury. Acidity is a central feature of this drug. This is iris versicolor. Versicolor matlab different colors. Different colors. This is the plant classification. Iridaceae. The Yakir understanding of iris versicolor. Basically, they are haughty, nobility, and work issue, overworked. Work issue we have also in Rutaceae family. Rutaceae family. Iridine is the alkaloid. Iridine is isoflavone type of flavonoid. 7-glycoside iridine isolate on several species of Iris florentina, Iris versicolor. It is found also in Iris kimanosa. It is called blue fag, and this is seen in Great Britain and Ireland. The specific epithet versicolor means various colored. This is important. Various colored. Introduction to iris. Leaves and roots are poisonous, can cause stomach intestinal inflammation. Irisine and iridine and irisine may cause gastroenteritis if ingested in large amount. Many protective and herbivorous rabbit and deers. The iris have been given magical plant when carrying root, give financial gains or place in cash register. If you want to gain more money, put iris in your cash register. More money you will get. So iris is a official flower of US state of Tennessee. Blue fag, flower of Quebec. This is class indication of iris work. Anus fissure, bilious attack, diabetes, diarrhea, dysentery, dysmenorrhea, dyspepsia, eczema, fistula, liver affection, whitlow, herpes zoster. Clinical indication. These are the clinical indication. Psoriasis with silvery color spot. This is the entry point of iris. In psoriasis, rectum burning, rheumatism, salivation, sciatica, vomiting, whitlow, and zoster. And just you see book by Dr. Sarkar. Burning and acidity in the abdomen is the entry point of iris, and belladonna like dream. And sick headache, increased saliva, constipation and vomiting, warts, Kali beach like discharge. Recently I had a case of oral carcinoma treated with Kali bichromicum. Completely cured, and I can show you the video of this patient also. I have recently done psoriasis with gastric acidity and one of the best keynote. ML Tyler, clinical understanding. Iris is one of the great polyclinic drug of many almost universal use, definite place in Mathematical, which no other drug fills. Very important sentence by Dr. ML Tyler. It affects the skin capitis of babies. Black type of herpes. Herring says iris will abort felon. One of the best drug for sick headache. Nash says I give remedy for in the third for last year giving it 50 m and please good result. This is the narration of Nash case. Calibase was given with no benefit, but iris cured her completely in short time. Birth characteristic. Birth's materia medica or birth characteristic materia medica. In pustular disease of the skull, it has great value, like mesarium, Vinca minor. Now case 6, I think it is the last case for the evening. A case of an old man aged 50 years from Bharuch district came for the complaint of urticaria with liver disease. Like anorexia, lying on the left side was worse, ringing in ear, sound remains for a longer time, swelling of both lower limb. This is important in this case. Tongue discoloration, white, red papillae, observation. On examination and observation. Salivation during aggravation. He had bitter taste in the throat, not in the mouth. This is very important. ये underline कर लो या you can write it down. Pain in legs with gastric complaint. This is the entry point of this drug. He had gastric problem after eating ghee, cream and butter. This is also the entry point of this liver remedy. Very religious, almost fanatic. Duty does it haphazard manner. Takes duty response very seriously. When he scolds children, there is quick grief or repentance. That is the main symptom of case 6. The remedy is Tilia trifoliata. This is the repetization sheet. Discoloration, tongue white, accompanied by papillae. Salivation, sleep during aggravation. Taste bitter, throat, not in mouth. This is important, not in mouth. Complaint of stomach accompanied by limb pain. See? Disorder, fed food after. Lying on side, left side liver. Swelling feet, liver disturbance in, my God. Extremity, swelling feet, liver disturbance in, exact symptomatology. Skin eruption, urticaria, liver symptom. Food, drink, butter aggravation. This is the last symptom of that patient. Now, duty perform in perfunctory manner. This is important. Perfunctory matlab when you are not seriously doing your own duties. Religious affection to the fanatism. Responsibility taken too seriously. Remorse with guilt dependence and clairvoyance. Perfunctory manner, we have 2 drugs, unanimous, which I have shown, and Tilia trifoliate. Urticaria with liver symptom. Calcarea floor, myrica, Tilia. This is the Phatak repertory. Liver symptom with calcarea floor, myrica and Tilia, Pitilia. And another drug Adonis adds is Extachus fulitis. This is perfunctory manner, half-hearted manner. 2 drugs, unanimous and Pitilia, done in superficial or half-heartedly manner, without interest or enthusiasm, bored. Pitilia was given in 6 BDS for 15 days. Learning entry point for Tilia cases. Urticaria with liver. Liver associated with leg pain and swelling. Wonderful mind symptom is routine work done in perfunctory manner. Worse after eating fatty food. Very important of Tilia cases. This is the Tilia. See, there is 3 part. 1, 2 and 3. Trifoliata. 1, 2 and 3. 1, 2 and 3. Trifoliata. This is basically from Sapindales, the Rutaceae family. Tilia and Pitilia trifoliata. Pitilia trifoliata is common oak tree, wafer ash, sunk bush, flowering citrus family, native of North America, Canada and Mexico. Disease is shrub or tree with alternate trifoliate leaves. This is important of Pitilia trifoliata. Virginia plant from King Gardens of England. Scientific name derived from Greek and Latin, which means 3 leaves elm. This was originally elm tree. Elm tree, this wonderful tree. I can show you in internet, elm tree. This name was derived from the fruit, bitter alkaloids, essential oils, acting replacement for hops in flavoring beers. So this patient or people use for flavoring beers. Now, mind symptom of Pitilia trifoliata. Work, duty routine, perfunctory manner, performed in, oversensitive to noise. This is very important Pitilia cases. Oversensitive to noise. Responsibility taking too seriously. This is also important. Aurum has this responsibility. Carcinosin take seriously. Calcarea. Religious affection too occupied with fanatism. We can even say eccentricity, remorse, indifference to duty, hurry, forgetfulness, delusion, neglected duty, yes, clairvoyance, anger alternating with quick repentance, crocus we have, reserve, reading unable to read names, handle things anymore, cannot settle owned by stress, support desire. This is important. This sentence. Tobacco, smoking, desire for. Heat flushes of menopause during. Food, SAR acid emulation. This SAR emulation is important for Rutaceae family. Squeeze onion. When you squeeze the onion, no? The squeezing onion is Rutaceae essence. Generalities after eating. Breakfast emulation. Dream being foreheads in. Electric current sensation in hands. This is very important again. Electric current sensation in hands. Abdomen pain, umbilicus. So Petelia trifoliate has the affinity for umbilicus, in and around. This abdomen part, liver, cheese after pain, walking, then liver with celiac disease. Many celiac diseases can be treated. Stomach nausea after eating fat. Strawberry tongue. Okay. Now these are the few which I am working astrological with liver disease. This is the astrological chart where Guru or Jupiter is involved. Is Jupiter god for liver disease? The mount of Guru is there in our palm, the area of Jupiter. This is the Jupiter for liver disease. This is important. This is mount of Jupiter, Saturn, Apollo, Mercury, different mounts for study. Even I take the hand, palms in the photo, ears. These are important anthropological study. This Aeschylus, there is a case, but this case was not, I was not able to show this case, but I'll tell you about Aeschylus in liver. So in liver, this is important, white stool. I once thought it is powerfully influenced the liver, entirely spending its secretion producing white stool. But my better knowledge of physiology has taught me that the white stool are caused by follicles of colon not performing their function. This was given by birth physiology for Aeschylus liver. Clark says malaise, dullness of head, fullness of root of nose, soreness pooling in the liver, jaundice with bileless stool, copper white textbook, causes congestion, very important. Lilienthal, this is the Lilienthal indication. Pierce-Flintock, central point of action is liver and portal system. Jaundice, depending on the cough, depending on liver disorder. Stuart Close. Now this is my last slide. This is homeopathy in nutshell. It is a shell that which some work hard to crack. When cracked, it is found to be packed full of sweets and wholesome sweet with no worm in it. It is the last line. Now I'll invite you all for questioning. It is just half an hour to finish off. It's 3:30. Dr. Mansi or someone? Check.
Sir, good evening, sir.
Yes, please.
Sir, for hydrostasis case as well as in Cordesmar case, potency and reputation, sir.
See, potency, what I told you, it depends on the case to case. What Stuart Close said, it is a Gordian knot. You have to solve by own understanding. First, we should see the immunity. We should see the age, susceptibility. I started with Q and then raised slowly to 6 and then 30, then to 200. and followed by LM potency, depending on the follow-up of the patient. Usually, I start with mother tincture if the symptoms are very bigger. But if I get some mental symptom, you can start with 30 or 200. And for your understanding, 30 I use for psychotic cases. Are you listening?
Yes, sir. Yes, sir.
630 and mother tincture for psychotic cases, and 200 for syphilitic cases, and 1M and 10M for psoric cases. This is how I practice in my clinical understanding. Thank you.
Understood, sir. Thank you so much, sir.
Anyone else? Shall we call it a day?
Can you please say again? Did you say the 1M for syphilitic cases?
1M and 10M for psoric cases. Syphilitic
Okay.
cases will take up 200 more. More better, you will get result in syphilitic cases with 200 potency.
Okay, thank you.
Psychotic cases with Q6, 30, 1X, 3X, 4X, these are all for psychotic cases. This
Thank
is my
you.
own clinical understanding. It can be different for you people also. From doctors to doctors, it's a different understanding. I have seen in my practice 200 working for syphilitic cases more. Shall we call it a day? So that's all. Thank you so much, Homeopathic Musing. There are patients which are waiting now. I have to hurry now. Thank you so much for inviting me on this platform. I regularly do this webinar for my student and my colleague, which are free of cost. I have done webinars on prostate cases, webinar on cancer remedies will be in near future. So all are invited. Thank you so much, and we'll meet soon.
Please,
Thank you.
please you
Hello.
send about the price. Can you say about the price of your course?
It is priceless, madam. No price for it.
Wow, thank you.
I do it free of cost, madam. No
Wow,
price.
thank you.
Sir, one doubt, sir. Sir,
Yes.
portal vein block cases are there in liver cirrhosis case. Liver cirrhosis
Yes.
cases almost portal vein blockage, and the cavernoma has formed in that case. Can we use this aesculus like
Yes.
medicine?
That's what I told you, no? The Boger is the, Materia Medica will give you the pathophysiology, where the
Okay.
veins are involved, and then the portal part vein is involved. This is how we should use Aesculus. You should use lower potency depending on the case, what I told you. No?
Okay.
If it is a case is dominant myasm is psychotic, start with the lower. If it is on the syphilitic, give 200 medium potency. If it is a psoric, go to higher. Or if it is psychosoric, you can go still higher. You have to read JHLN.
Okay.
JHLN.
Okay.
JHLN gives you guidance for all the potency. During Hahnemann time, Hahnemann was fed up with this potency. So he said, start every case with 30 potency. So we should not start every case with 30. Every case needs different potency. It can come from 1x to 0/30 LM potency. You can even give 0/30 also when the case is needed.
Okay, sir.
What case demands, you should prescribe.
Okay,
Case,
sir. Almost liver cirrhosis cases will be a psychosyphilitic background.
yes, psychosyphilitic. You can give 200 potency in 5-cup method. 5-cup method. Or then you switch to LM5. LM4 and 5 is for syphilitic.
Okay, sir. Okay, sir.
1, 2, 3 is for Sorik, and 8, 6, 8, 7 is for Sorik.
8, 7, 4. Sorry. Okay, sir. Thank
Okay.
you. Thank you, sir. Thank you, sir. Okay.
Thank you to all.